So it's gonna be up to us guys to try and persuade them to come to things like this. Tell them the benefits of group like this. To get tested like I did today, and encourage them if they have like also. It's just generally, it's gonna be like a man talk for a guy to follow your group like this. Yeah, so tell them I did it, it's good, do it. It's a good thing, it's gonna get you to a better place or better health status. So it's gonna be, the work is just up to us. And you ladies cannot tell men anything and listen. They will not listen and tell me.
Same everywhere.
All of them, they think that this disease is brought by the women. You know that? All the time.
Yeah,
all the time.
Yeah, the things
And most of them, and you know very well, men are the hunters. They are the ones who hunt for this disease. Yeah.
Hunt for the disease?
Yeah, because when that's why I call you hunters. It's not like using the word bad word. Because men can have 5 girlfriends at the same time. Mostly women, they have 1 man at a time. But for you guys, I don't know how you pray it, you can have even 5 at the same time.
Not all men. Not all men. Not all men.
I'm saying most of them.
And that's why this conversation is so important, because everybody's belief and everybody's perception is completely different.
Yeah, it is important.
And let me put it this way, as you asked Jay, actually the last meeting where we were last month in Kent, we forwarded the same suggestion to Tina about men, how men should be, involved.
Yeah, because this is the 3rd group that I've been, and it's the same thing. It's just
women are
women.
very obedient. When they're told to come out for something, they come. But men are so adamant. The man ego disturbs them so much. I don't know.
But I think the thing is that they only focus in the women. They need to also focus on recruiting men.
Yeah.
So I'm thinking if you guys have like husbands or boyfriends or brothers, you should just encourage them to,
I was about to say that.
Yeah.
Now, most of us here, maybe they have better half. Why can't you try, we try to come with your better half?
Yeah, I think that's a good idea.
That's a good idea.
Yeah.
Who has the better
And then, if you have your better half, like your husband, that is, if you come with your husband, then your husband can invite a friend.
or they
Next
can go
time,
talk to their sons about it.
And then, or you come with your son. Yeah, that's important. So if I don't have a husband, I can come with my son next time, and then my son will invite another one. So that way we can include our men.
There's one thing about age in any community about the culture. It's like we used to imagine that we cannot talk some of these things with our youngsters. And some of the words you don't want to mention them because you say, oh no, I have to look down and
No,
say,
me I
these are
teach
young.
mine.
I'm talking, I'm saying what it used to be. But of late, this thing now, it is free. You can talk to anybody. Because I remember when we were taught on what to do, to go out there in the villages and educate these people, we used to mention, just put a cover in your in front of you and just blind your ears so that you can just talk. Tell them whether they want it or not. Tell them the reality and the consequences of whatever. And with that, you will have saved us all. Yeah, no matter what.
So, I was just curious, because when it comes to the testing, most men might not feel comfortable coming and get tested. I don't know how many men got tested today. But isn't there a new product where you can get tested in the privacy of your own home?
Yes, it's called OrClick.
Okay, so is there a way maybe to provide that at events? So
I've actually been looking into it, and the cost of it right now is just really so expensive, and the funding for most organizations is nil. It's very small.
okay.
So it's something that's being worked on within our community, and hopefully it happens sooner than later. Yes. And there's just one real quick thing I would like to say about the OrClick tests, is that if you know anyone who wants to get tested and who is going to test themselves at home, please encourage your friends, your family, whoever might be doing that at home to follow up if they do become positive, if they know that they're positive. Do the best that you can to encourage them to follow up with care, to follow up and get meds and get into medical care.
To add to that Tina's question about what are you doing for, I think, and I had this discussion with Solomon and Jay, it's caring for people, you know what I'm saying? Because I think it's easier for someone to step forward when they know that they have the support they need, you know what I mean? So I feel like if we just realize that we're all humans, you know, you're my sister, you're my brother, we're human beings, and just give out that, you know, vibe that everyone's looking out for you, I think it would help, you know, so don't look down on your neighbor and just, I guess, just care, I guess.
I'll tell you, that helped me come out of my shell. It's when I started receiving support. I hadn't talked about HIV. I thought I was alone. You know, I was scared. And I met the babes at the AIDS Walk in Seattle in 2008, and it completely changed my life and my outlook on my diagnosis. And it changed my ability to talk about it and to inform other folks about it so that they wouldn't end up being in the same shoes that I was in and not knowing what was going on when I was diagnosed. What is going to happen to me for the rest of my life.
Yeah.
And I'm going to be okay. So, yeah.
So,
Go ahead.
I have a question here. I mean, it's a suggestion that I want to make that this is the third meeting that focus group we're having, and the people that we have the last two sessions, most of them are not here. And what I'm suggesting is that when we have a discussion, it's not like we come here together one time and we discuss it, okay, we go home, okay, leave it there. We just want to act and encourage each other and continue meeting and discussing and recruiting, you know, encouraging the, you know, other people. So I would like for you to involve our next session, whatever it is, maybe twice, you know, 2 months, once a month, whatever you guys. I know everybody's busy and everybody doesn't have the time to meet all the time, but we can exchange emails or phone and talk about it and keep encouraging and empowering each other. So by the time that maybe next year we can succeed our goal. But if we talk here and leave it and say, okay, we have a discussion, by the time I go home, I don't even remember what I discussed and speak about it. That is kind of, you know, wasting your time and energy and discouraging to others. So let's keep encouraging each other, let's keep contacting and, you know, reaching out to each other. So that's my suggestion.
It's a great suggestion.
Yeah.
I'm going to move on with a different question. Let's see. How can we, as providers and as the folks sitting in this room, how can we encourage everyone to get tested for HIV? What can you do individually or as a group to encourage others to get tested?
I know that because it is hard to get people to go on their own. It's going to where people, like going to churches or going to mosques or going to community, where, you know, where community is meeting, or basketball tournaments for guys, or, you know, wherever people are, and, you know, like trying to incorporate HIV testing and education and things that people are already doing, so that they don't have to like go out of their way to include, you know, continuing to do focus groups and continuing the dialogue.